And I'm back now with Dr. Lisa Sundean, Chairperson of the Board of CCNW. Great to see you.
Thank you, Mabel. It's good to see you too.
Well, of course, Dr. Sundean, you hold a number of other titles, but that's just one of them.
Yes.
What are some of the goals that you hope will be achieved during the meeting, this summit of people today?
Well, first, I'm really happy to see so many different stakeholders come together today here for the Connecticut Center for Nursing Workforce Summit. Stakeholders who don't necessarily ordinarily come together in this way to talk about the nursing workforce in the state. So I'm really hoping that we can have a collective conversation of shared interests and goals to better understand the needs of our citizens with regard to health and healthcare in Connecticut and ways that the nursing workforce can contribute to improving our healthcare issues and situations here in Connecticut.
Okay. You teach nursing
I
at
do.
the University of Massachusetts.
In Boston,
in
yes.
Boston. And are you finding that there are a growing number of people coming into the field, or are the numbers softening?
Oh no, excuse me. Enrollments in nursing programs and applicants for nursing programs are at an all-time high right now. We go through ebbs and flows, from decade to decade and year to year with that. But right now we're at an all-time high nationally in many parts of the country. One of the issues, however, that we're finding is we really do not have enough nursing faculty in order to fill more seats with students. So that is a major issue that we are trying to manage nationally and here in Connecticut.
Okay, because most programs require that the faculty has at least a master's, a PhD, perhaps to teach classes. Is that right?
That's right. In most baccalaureate programs or higher, the entry level for the faculty is a PhD or a DNP or some doctoral or terminal degree.
Okay, so if we're at an all-time high in these programs, will states like Connecticut be able to benefit from those students coming out after they finish school?
Oh, most definitely. I mean, we're preparing very strong candidates for nursing, for the profession. There is that transition time where a new graduate is still learning, just like a physician. When they finish residency, they're still learning. In fact, we're all still and always learning. But the new undergraduate nurse, the baccalaureate degree and associate degree nurse, they're still in a process of learning, and there is some time that they need for that transition, particularly when they're very new and they're going into high intensity types of environments. So what we're trying to do in combination with our academic folks as well as our practice folks is to build and develop and nurture nurse residency programs. And this is happening all around the country, nurse residency programs to kind of bridge that time from graduation in a program to full practice where the learning is supported.
Okay, so in Connecticut's quest to build a robust and sustainable nursing workforce, what else is needed here to ensure that you attract the right kinds of nurses and that you retain them?
So that's the golden nugget right there, right? Attract and retain. And I think that I don't want to really say exactly what we're doing because there are lots of different things that organizations are trying to retain really good nurses. The reason why I don't want to say what we're doing is because I think we're still in a stage of figuring that out. And I think part of figuring that out is really understanding the generation of nurses who are graduating today, particularly the younger nurses who are graduating. It is a different generation, and we need to better understand what makes them tick, what makes them stay and what makes them go. So nationally, again, we're seeing high turnover rates in younger nurses who, at first we thought that younger nurses were leaving the field within 2 years, that they found out that it was really hard and they really didn't like it. But now what we're learning is they're not leaving the field, they are more willing to go from one organization to another. So that puts a stress on hospitals or whatever setting they happen to have gone to, while they're trying to replace these nurses who are kind of rolling in and rolling out, that revolving door situation. The good news is they're staying within the field of nursing, in the profession of nursing, but they're moving organizations. So really what we need to do is to find a way to keep them in one organization so that we can help develop them in the ways that I just described in terms of nurse residency programs, and also to get our return on investment within the organization. As you know, it costs money to onboard any new employee, and it costs money when they leave because now you need to onboard somebody new.
Right.
So that, I think, is the golden nugget right there, is how to retain and understanding what are the patterns and behaviors of the millennial nurses in particular.
Well, because you're teaching a lot of these folks, you're in that unique position of actually hearing directly from them about what they want. And what are they saying?
Well, they're really not willing to put up with poor culture.
And that would be what?
Inflexible hours, poor pay, incivility in the workplace. And then there are some things that they're maybe unwilling to put up with that maybe they just need to realize that's part of the game.
Okay.
Long hours. It's hard work. Nursing and healthcare is hard work. You have to have a passion for it. Some people say it's a calling. So it's a little bit of give and take there. When I'm teaching, some of the things that we tell our students is that if you are in a poor culture environment, you might choose to leave, and that might be the right thing to do. So that's the message to organizations, to say you need to create the right culture for employees, whether it's nurses, physicians, or other. We know that burnout is at an all-time high for healthcare professionals, nurses, physicians, and others, and sadly suicide is becoming a real epidemic among healthcare professionals. So part of that speaks to the culture of our healthcare environments, and realizing that we need to pay attention to that if we're not taking care of our own professionals, then we can't really take good care of our patients either.
Right. What are some of the strategies that are working, that you're seeing success with?
I think making an intention to change culture, to understand the different generations of professionals who are working in different organizations, understanding what makes them tick, what makes them stay. Those are the kinds of things that we really need to look at in order to retain.
Okay. What are some of the takeaways that you believe people will be leaving with today?
First, we need to build a pipeline for nursing faculty, as we just suggested. Without that, we can't educate more nurses, and then we can't have that sustainable and robust and diverse nursing workforce that we're looking for. So that's number one. And number two, I hope people take away just how critical it is to bring together a diverse group of stakeholders around health, around the nursing workforce, and around the healthcare workforce in general, to talk together to solve common problems rather than to solve these problems in silos.
Yes. I mean, certainly there is disconnect between, people know a lot, but they're not talking with one another. And traditionally that's because of what?
Silos are built, why? Because we all think that we know the best way to do things, and that, that other group over there couldn't possibly know as much as we do. But we also know that when we break down silos, we learn from each other. We're better together. And that's really what we're looking to achieve here today.
And is there anything I've missed, Lisa?
I don't think you've missed anything. You know, we're passionate about the work that we've been doing here with the Connecticut Center for Nursing Workforce, but I think it's important to understand it's not just about creating nursing as the center of the universe or the center of Connecticut. It's making sure that we are bringing nursing to the table to advocate for better health care for our citizens in Connecticut, and to do that in collaboration and cooperation with so many other agencies and professions around the state who have the same goals in mind.
All right. Dr. Sundean, thank you so much for your time.
You're welcome.
Appreciate it.
Thank you.